I had my child and I was 19, still a teenager. Wasn't really sure about, how to raise a child. I was living in a basement apartment, moldy, basic basement. It was, it was horrible.
When I first saw him, I couldn't believe it. I'm like, I'm a father now. This is the reason that I was raising it on my own. It makes me feel more like some person have some responsibility to do,
If every kid came with an instruction manual, we wouldn't need something like Healthy Start. I think with what we've learned with the new brain research in the last 10 years, the importance of the early years in life, it's very important to be able to access parents just after a child is born. And Healthy Start is a really good vehicle to access those parents when they are hungry for information.
My name is Amber and I was born in Portland, Oregon. I was raised in Mount Angel, Oregon with my parents. Down from the bottom of my heart, I really think that the Healthy Start has really helped my life. I really appreciate all the time they spent with us, all the help they've searched for us. For my husband and I, it's been a little rough. I mean, I've lost my job and looking for another job, but Healthy Start has come in and they've helped us without ever asking anything in return. I'm just so grateful for that.
The first time I met Amber, she had this little tiny baby, and like most new parents, had all these ideas when she was pregnant, and then they put this baby in your arms and it doesn't quite work out that way. It didn't take very long for her to develop real enthusiasm about working together to decide what she wanted to accomplish as a parent. She would take the ball and run with it. She got really excited about parenting.
Healthy Start started in '94, and Marion and Polk counties were one of the first pilots. And it's proved over and over again, the numbers of families, that it has really helped by reducing the numbers of emergency room visits, increasing our immunization rates, and increasing those families to have actual primary care providers. It's really emotional, mental health, and physical health that makes up a healthy child. And those are the things that Healthy Start has been working on from day one.
Prevention is really the key from a lot of different standpoints. I know that financially, of course, it's a lot less expensive for a community to put money into preventing problems rather than having to deal with them down the road and having to spend money on treatment and jail time and prisons and that sort of thing. And I think that families deserve the opportunity to have programs in the community that will offer them the support that they need and help prevent those problems and teach them the skills that they need.
My name is Celso, and I was born on September 12, 1971, on Fresnillo, Zacatecas, Mexico. Family of 8. I was helping my mom raise him because my parents have to work, both of them, and learn how to cook, how to take care of them, and that's how I feel kind of secure right now raising my boy,
Celso's an amazing dad, amazing person. It's a very rare occasion that you see a man want to step up to the plate and do as much as he's doing. He works all day, does everything that you would consider a single mom to do. He's doing it all on his own. He even says, I don't know how women can do it, but he motivates himself and he does a really good job and he loves his child. The baby's mother is not in the picture at this point because she suffers from a serious mental illness. Child welfare said that it was unsafe for her to be around the child. Celso's done everything that he can to reach out to her because he feels like his child is the most important thing to him and he wants his child to have both his mom and dad. I believe that Healthy Start has made the difference for Celso and Christian.
One of Healthy Start's functions is to help reduce abuse and neglect. And several longitudinal studies that have shown over a long period of time those kids that have had the benefit of this early intervention and help and support fare better, not only through school, but later on in life. They earn more, they pay more taxes, they're more successful.
It's difficult for me, and I know for a lot of our staff, to not be able to offer those services to so many people and to really have to triage so much and turn away people with such high needs, because I think the impact of our program is so great. But I also am really proud of the work that we're all doing, and I think that the families that we are serving are getting wonderful benefits from the program.
He is the world to me. He means everything to me. I mean, every day when he wakes up and goes, "Mommy, I want cereal," it breaks me.
I feel proud that I made it so far to that point, you know. I feel proud that he's still alive and talking to me and with my little buddy.